Welcome to the Elevating Aesthetics podcast. I'm Brittany Perez.
I'm Courtney Burke.
And today we have Hunter Jennings with us from Cartessa.
Hey.
So Hunter, tell us a little bit about yourself.
Yeah, I'm the area sales manager here in North Florida. I cover most of the Panhandle with Cartessa Aesthetics.
Awesome.
Yep, and brought you guys a coolpeel.
Yes, you do a ton of coolpeel. Living in Florida, it is a little bit difficult for laser sometimes, but really we have summer season year round because in Florida people are constantly out in the sun. So we love having the coolpeel available, and then we also have the DECA device with Cartessa.
Absolutely.
So really what I wanted to talk about is what makes your device different than all the other lasers on the market.
I would start with our company is our devices all check 3 boxes. Are they efficacious? Do they work? Are they comfortable? Patients don't want to be jumping off the table, going through a lot of pain.
Yeah.
And then as a practitioner, is there going to be a good ROI? So are they going to make you money? Because you're all running a business. And so we have that standard for every one of our devices. As a company, our reps are allowed to operate almost like we're our own business. So we can come in and support practices and help you guys develop and give you, whatever, meet your needs, to achieve your goals. And then coolpeel in particular and the Tetra, what sets us apart is that it's a CO2 device with minimal downtime. Back in the 90s when you did a CO2 treatment, you were stuck inside bleeding and oozing and, looking like Freddy Krueger for a week or two. It's not, and that's not where the market is. So you're still getting a nice ablative treatment with a day or two of redness. And that's where coolpeel really stands apart.
And what makes coolpeel have a faster healing time? What is it about the device?
So it's our time on tissue, and then our ability to control where the energy or the heat's delivered. So you don't have the thermal damage that causes your downtime.
So instead of having like a full field ablation, you have like a fractional ablation to where there's a lot of tissue that's still healthy.
Absolutely.
And so the tissue around it that's injured can heal faster because there's healthy tissue and injured tissue.
And with the name coolpeel, tell me how you got your name, because it's definitely not cool and you definitely do not feel.
Yeah, it's a little spicy, but because there's the lack of thermal damage. So that's where the coolpeel name came from.
Which is why it's great for melasma patients. And melasma is one of the most difficult things to treat. How does it work on melasma patients?
I think because how versatile it is. Melasma is really tricky. You don't know how deep the melasma is or superficial. So you can really, you can tailor that treatment, to that specific patient's needs.
Yeah, because there's epidermal melasma, there's dermal melasma. And like you were saying, the depth of the treatment is based on the provider. You can go to a bunch of different settings. And the nice thing with it is that it doesn't keep heat in the tissue for a long time, right? The heat goes in and out.
Absolutely.
So we don't have to worry about making melasma worse because...
like you said, melasma's tricky.
It's so tricky.
It can be a nightmare for, patients and practitioners.
Yep.
So it's a great tool for that.
Yep.
And then what about like scars and fine lines?
Oh yeah, that's where it's really getting into what is just great about it. Fine lines and wrinkles, pigment, acne scars. It's great for that. We jokingly call it the Florida laser, because a lot 99% of your patients are going to have fine lines and wrinkles and sun damage, and that's where the Tetra and the coolpeel really shine.
And it's nice because you can treat all skin colors.
Yeah. If you'd have said 10 years ago to treat a CO2 patient who's a skin type 6, you would have never done that.
Yep.
Couldn't have done it without, causing major issues. And we can do that. So
I think that's one of my favorite things is the versatility of the device, because I can have a patient with some like superficial pigment that I can set on a coolpeel setting and just do the epidermal layer. Or if I have someone that wants some jawline tightening and they have some deep brightids along their cheeks, I can use the DECA setting for that.
And stack.
And do the double stack. We learned how to do the double stack
stacking
with
pulses.
Lisa.
Yeah, absolutely. Lisa's great.
She's awesome.
Your 25-year-old patient who wants a maintenance treatment, or your 75-year-old career smoker who's never worn sunscreen once. Yep. You can treat them both and everything in between. There's no consumable, and it's a short, treatment time for the practitioner. So that's great.
The no consumable is my favorite part as a business owner, especially now that, which as much as we love our Cyton device, there's a super high consumable associated with every time you click the pulse,
Yeah,
so from
absolutely.
a business perspective, that's really nice.
No doubt about it. So that's just another great thing about the Tetra.
Yes.
Why did you go with the Tetra and the coolpeel? What stuck out for you as a business owner?
To be completely honest, I am not the laser queen. As we all know, my partner, Katie Reaver, is the laser queen. Always has been, always will be.
She'll blast somebody, baby.
She goes hard and heavy. Safely, yeah, she does a great job.
Absolutely.
And she had a lot of experience with the device from her previous practice, and she spoke really highly of the company and the device, and she was getting really great results. So I honestly just leaned into her advice with getting the device, and I didn't think I would use it. I was like, "That's cool, you go ahead." In the beginning, remember, Courtney, I was like, Katie's the laser girl, because for me, I know what I'm comfortable with, and I know when to refer out. But what I will say now, from my perspective, is it is so user-friendly from a provider perspective and so safe for the patient that I use it every single day. Like, there's not a day that goes by that I don't use it in my practice. So I'm really glad that Katie made the call to get the device. I wasn't the one that chose it, but I'm so glad that she did, because it can be used on any of my patient types for a multitude. It can be used on my 20-year-olds that have some melasma, all the way up to my 65-year-olds that have deep rhytids and want some collagen stimulation. So
absolutely.
It's very versatile. I love it.
And I will say, like, in our practice, a lot here lately, we've been using it for bruising.
Yes, use it a ton for bruising.
And the bruise is like gone the next
Those
day.
before and afters are awesome.
Oh,
it's so cool.
That's probably my favorite use of it, honestly, because I tell my patients all the time, anytime we stick a needle in your face, you're at risk of bruising. And unfortunately, I can't see what lies underneath,
Yeah.
And that's the risk that they take. The ability to quickly resolve a bruise, and a patient has an event coming up, like, that is going to make them love your practice even more.
Yeah, absolutely.
And when you're treating a bruise with coolpeel, I'm not worried about eliciting like a blister, because we're not targeting melanin. We're not targeting the actual pigment. We're using heat from a water chromophore to disperse the bruise and heat and liquefy the blood. And so from a safety perspective, as a business owner and as a provider, I'm not worried about causing a worse complication than a bruise. I love it. Y'all should put that in your protocols.
Yeah, I love seeing those before and afters. I think they're so cool because it just erases it. It's like it's almost just gone.
Quickly. Again, we did some dissolving with Hylenex, and Hylenex bruises you so bad.
Like, her lips were black.
And the whole thought process for most of the years that I was injecting was just to ice, like 4 or 5 days ice. It's going to take 2 weeks for your bruise to go away. But now that we know that icing will stop the bleeding, but heat will make it go away quickly, and we have the capability to do that, it's fantastic.
It's the cherry on top.
Yep.
Absolutely.
I love it. So what do you see like coming in the pipeline? Because I know Cartessa has other devices. We only have the DECA. We have the Tetra, the CO2, and the DECA.
Helix, the newest CO2 device that came out. And we got a few different things coming down for some surprises towards the end of the year that we're excited to get out to the market. Just released our Physique 360, a new body contouring device. And in my 3 years in the industry, I've never seen anything take off and go to every reach of the aesthetic world and beyond, like we have with the weight loss stuff.
Yeah.
So,
oh my God.
Kind of help with that rapid weight loss. You have muscle atrophy.
Yep.
So it addresses that, and as well as skin tightening. You do lose that weight, but then you create other issues. This device helps deal with those issues. So you can offer like a full circle treatment of weight loss and body contouring with it. So we're really excited about that.
I think that is going to be amazing. I think one thing that we've been working on more in our practice is to try to focus more on the body, because we're so face driven. But so many patients, like you say, they come in and they've lost 100 pounds. I actually had a patient today, and she had lost like 140 pounds, and she had significant laxity in her thigh skin. So to have something that she could do non-surgically to kind of tighten things back up would be great.
Yeah, it's been really, in the before and afters have been really good. We released it maybe 2 or 3 months ago. So, we're still learning about it, and it's definitely been fun to see the device grow. We had our spokesperson, Danica Patrick, use it the other day on Instagram.
Is that who it is?
Yeah,
I
so
love her.
that was pretty cool. We were excited about that.
That's so cool. I love Danica Patrick. If you had a provider or business owner that was thinking about adding the device, what would you tell them?
Like we kind of just talked about, that you're offering a complete solution to body contouring in addition to their weight loss. I think that was, because you are going to create those two things, those two problems. With they're going to lose 30% of lean muscle, and then they're going to have skin laxity. And we're going to offer you a solution to help treat that too. So you're offering a full package deal for your weight loss patients.
And for that device or for the Tetra, what do you offer after you sell the practice a device? Because what I see with a lot of companies is they sell the device and then they wipe their hands of you and they don't have any support afterwards. So in the sense of ongoing support, ongoing training, ongoing marketing assistance, what does that look like?
Yeah, so our company was kind of started with the running joke that how do you get rid of a laser rep? You buy their device. And our CEO didn't like that. He works for another.
Why is that so true, though?
That's a lot of different ways you could go into that.
But
I think
we'll skip that.
Yeah,
That's the
absolutely.
tea,
Yeah.
Tea.
No, I think we want to build a relationship with you and grow with your practice. So not only that, we want to see you be successful. I think almost 50% of our sales in our territory last year were repeat customers. I think that speaks to the fact that we sell you a device that's going to work. It's going to do what we tell you it's going to do. And we're going to continue to supply the support for you going down the line to help you grow.
Yep.
And then you're like, all right, well, we got our Tetra running, or we have our virtual arc micro needling running. What's next? What's our next avenue? How do we branch off? How do we continue to grow our business? And people, we don't ruin relationships by just dropping the laser off and you never seeing us again.
Yeah.
So they say, their first call is, Hunter, what do you have to address this? We have 17 different devices that are all great devices. So we can find something in that avenue to help you achieve what you want to achieve.
I love it. I don't know how much experience you have. The last time we chatted, I was asking about your exosomes. Have you had any additional education on them?
I have not. It's been it's been a kind of a wild 8 weeks for me having a baby.
That's true.
Yeah, selling a house,
baby
buying
girl.
a house. I know we're getting dramatically quicker downtime, especially with your aggressive DECA treatments and things like that.
Yeah.
You're cutting downtime in half probably.
Do you know the source of the exosomes?
It's Wharton's jelly.
Wharton's jelly. Okay.
Mm-hmm.
Okay.
Yep. And I know it's all sourced. Like you can trace the source. It's from a lab in New York.
Okay. And Wharton's jelly is umbilical derived.
Yes. All right. I'm agreeing with you. I don't, I'll have to lean on your expertise there.
Wharton jelly is so interesting to me. I've worked with a couple of different companies locally, and I love the idea of it. I think my fear as a provider is the FDA regulation of it. And so having a company that's done the legwork to have the exosomes that are derived from that makes me more comfortable rather than, directly injecting the Wharton jelly itself. I'm
And those
definitely interested.
Cells don't get much younger than that.
No.
Something that's shelf stable, so it doesn't have any preservatives or anything like that, like byproduct to the body somewhere.
That's super cool.
All right.
Okay.
Cheers.
Thank you so much for coming on.
Absolutely. Happy
This was
to
so
do
much
it.
fun. If you have any other questions about the Tetra devices, the coolpeel or the DECA or anything else that Cartessa offers, just leave us a comment and we will get back with you. If you're interested in being treated with a CO2 device or any of the other services that we offer here at Mila, just send us a DM or call us at Mila. Bye.
Cheers.
Cheers.